Tonight, there is a countdown clock on healthcare for thousands of Georgians.
The state's Medicaid alternative could disappear by year's end if the federal government says no to a $1 billion funding request. Atlanta News First reporter Abby Casoris is live over at the state capitol tonight. So, Abby, what did you hear on this today?
Well, one doctor describes feeling haunted, unable to save lives because people can't afford basic care. Screenings like mammograms, basic supplies like an inhaler or insulin. They're too worried about going into medical debt. Georgia Pathways is the state's alternative to fully expanding Medicaid. Georgia is one of 10 states that hasn't. To qualify, you have to earn roughly $15,000 or less a year and prove you're working or in school for at least 80 hours a month. Critics say that requirement is why so few people signed up to speak at the hearing. Dr. Julia Chase rushed in straight from a night shift, still putting on her white coat, speaking directly to the two members of the 9-person board.
2 nights ago, I sent a woman to the neuro ICU with a brain bleed from metastatic breast cancer that traveled to her lungs, her liver, and her brain. And she'd noticed a breast mass months prior, but she couldn't afford a mammogram that I'm watching die because they can't get appropriate access to care.
Georgia once promised Pathways would cover 300,000 people. Today it covers roughly 18,000. Here's why that matters. A new federal law forces Georgia to change its work rules in January, and the state says that will cost more money than it has. So Georgia wants Washington to pay more without covering more people. That same ask has already been denied for Georgia, Wisconsin, and Utah. If Washington says no again, the state has suggested Pathways could end entirely. Researcher Dr. Blake McGee studies Pathway enrollees.
That would be catastrophic, not just for those individuals, but also potentially for the economy and for our state.
A Department of Community Health spokesperson says it's negotiating with Washington. Governor Kemp's office says the governor is committed to ensuring Georgians have access to quality health care while maintaining fiscal discipline. But for Chase, it isn't about negotiations. It's about who shows up in her emergency room next.
It really can break your spirit to want so badly to help people and to be stopped by a system of healthcare that is not always supporting that.
Public comment continues through September. DCH says they'll submit their final requests to the feds in October, but the time here is ticking. At the state capitol, Abby Casoris, Atlanta News First.